Which feature is not typical of a generalized tonic-clonic seizure? Visual hallucinations as an aura. Which diagnostic tool is most commonly used to confirm epilepsy? Electroencephalogram, EEG. First-line anti-epileptic drug for focal epilepsy in adults? Lamotrigine. First-line treatment for status epilepticus? Midazolam. Most likely cause of new-onset epilepsy in elderly patients? Stroke. Key characteristic of absence seizures? Brief loss of awareness without convulsions. Common side effect of phenytoin? Gingival hyperplasia. Anti-epileptic drug least recommended in pregnancy due to teratogenic risk? Valproate. What imaging modality is preferred in the first evaluation of a new-onset seizure? MRI of the brain. Which electrolyte imbalance is most likely to precipitate a seizure? Hyponatremia. For how long should a patient be seizure-free before considering a driving license application in Australia? 12 months. What is the primary mechanism of action of levetiracetam? Modulates synaptic vesicle proteins. Which AED is commonly avoided in patients with a history of renal stones? Topiramate. What is the typical EEG finding in absence seizures? 3 Hz spike and wave discharges. Which AED is known for its mood-stabilizing properties, making it useful in patients with bipolar disorder? Lamotrigine. What clinical sign distinguishes psychogenic non-epileptic seizures from epileptic seizures? Asynchronous limb movements. Which AED should be avoided in patients with absence seizures, as it can exacerbate them? Carbamazepine. What is the first-line management approach for epilepsy in pregnancy? Optimize AEDs to lowest effective dose, avoiding valproate if possible. What blood test is essential to monitor in patients taking valproate long-term? Liver function tests, LFTs. Which AED has the highest risk of causing Stevens-Johnson syndrome in Asian populations with HLA-B1502? Carbamazepine. What is the usual first-line AED for neonatal seizures? Phenobarbital. Which AED can cause irreversible visual field loss? Vigabatrin. What cognitive effect is associated with topiramate use? Cognitive slowing or word-finding difficulty.